Hi, this is Dr. Robert Davis with Active Health Complete Relief Care, and I am back answering your frequently asked questions regarding TriGenex and the procedures and therapies we offer in our clinic. The next question I have is, how can you help someone with peripheral neuropathy? Peripheral neuropathy is a condition in which the peripheral nerves, the nerves running either into your arm, into your hand, or from your low back into your leg and down to your feet, is affected. There are different causes of peripheral neuropathy. It can be chemo-induced neuropathy. It can be related to diabetes. It can also be related solely to damage to the nerve root, either in the lower part of the back or in your neck. So there's certain nerves that we're looking at. They're actually called neurokinetic chains. One is the cervical area. This is a cervical neurokinetic chain, and then the lumbar chain down in this area. In the cervical spine, the nerves that we're looking at are C5. C5 runs into your shoulder as the axial nerve. You have C6 in this area that'll run down into the forearm as your radial nerve. Then you have C7, which is your median nerve, and then C8, which is your ulnar nerve. Going to the lower part of your spine, this chain of nerves, the femoral nerve and the sciatic nerve, they run from L4 and L5, and the upper vertebrae can also contribute to those nerves. So we look solely at these areas because in the lower part of your spine, if you follow the sciatic nerve, it runs all the way down. I'm going to trace this for you. So here's your sciatic nerve distribution running all the way down. It innervates the muscle that unlocks your knee. We'll do it in black. So it innervates the muscle that unlocks the knee, called your popliteus muscle. And then it continues down as your superficial peroneal nerve into your toes. It runs along the back of your leg as your tibia nerve, and then your deep peroneal nerve goes right to the bottom of your foot. So how do we treat peripheral neuropathy? There's a number of different things we do. First, we have to get the pressure off these nerves. So I go right to the source, I do a neurological evaluation, and it can be in the upper extremity or the lower extremity, wherever you're being affected. And we test to see where that lesion is along the pathway. Because we want to make sure that if there's damage to this area, that we're taking the pressure off of these nerves in here or up in this area here. Once we do that, it's like you're taking the foot off the hose, and let's say you're trying to water your lawn. You wake up every morning, you got a brown lawn. Well, what are you going to do? Well, you're first going to look to see why the sprinkler's not working, why the water isn't getting to the lawn. So if there's a rock on that hose, you take the rock off, you remove the interference. Once you remove the interference, the flow can go through. Same thing in your nervous system. If there's damage, pressure on these nerves, that nerve energy can't flow the way it's supposed to. So first thing, we get the pressure off the nerves, wherever that may be for you. Next thing we're going to do, we're going to wake these nerves back up. And I do a therapy called a rebuilder therapy. And we line up, after we've done an evaluation, we line up these distal endings of the nerves from the low back, or if it's in the upper extremity, we're going to line them up with the nerves that come out of your neck here. When we do that, we actually have you do a therapy called intersegmental traction, and that's going to gently pull the vertebrae apart. While you're doing that, we wake the nerves up. We send a specific frequency back and forth to wake those peripheral nerves up. And we can do that in the upper extremity as well. Many people, we do it in both areas. The next thing we're going to do is we're going to work on that pain and inflammation. And the pain and inflammation can be reduced by something called PEMF, pulse electromagnetic field therapy. All your cells have a cell membrane and they have a nucleus. In addition to that, in order for those cells to work properly, they have to have a battery to run the cell. These batteries are called mitochondria. And mitochondria need to be charged up in order for those cells to work properly. If not, you get pain and inflammation. So we're going to work directly on the areas that are inflamed. Okay, so we'll work on these neurokinetic chains because if there's damage happening to those nerves, and then we can work directly on the hands and on the lower leg and the feet as well. The next thing we're going to do TriGenex. So we'll do the neurological treatment system called TriGenex. We're going to get a reset. We're going to get the brain to send the proper signals down through the spinal cord and across the nerves, whether it's in the upper extremity and the lower extremity. We will work with you on doing some specific supplementation solely to reduce pain and inflammation. Now, that is a brief explanation of what we do in the office. When you come in, I can go into more detail, but these have been very effective to help people that are suffering with peripheral neuropathy. God bless you, and I look forward to meeting you soon.